everyone, today's video we are going over the best mobility exercises or even just exercises in general that you can do before deadlifting to help with any low back pain that you might be having during deadlifting. My name is Dawn, this is Mandy.
Hi.
We are two parts to the locally world famous chiropractors here in Costa Mesa, California. And what I see a lot in deadlifting, we're going to get right into it, but what I see a lot with deadlifting is just improper warm-up. I don't know about you, but what I see is people typically will just start, maybe if it's barbell deadlifting, with an empty barbell, and then slowly progress the weight until they get to their working weight, and then they think that that is the warm-up beforehand. There's nothing wrong with that. But when we are dealing maybe with a back injury or something before, or something that is aggravating the back in deadlifting, there might be something that we just do to regress a little bit, offload the low back, get better helpers working, and then go right back into deadlifting, and now you don't have to take it away all that much. Just the simple modifications. So what I'm going to have Mandy do is she's going to go on her elbows and on her knees on the table here. And I'm choosing this one for this video specifically because when I assess people's squat patterns or hip hinge patterns or things of that sort, what I see is actually the mobility that's lacking is more in the upper back here. And so when we don't have proper mobility here, what we tend to do is find the movement through here or maybe somewhere into the hips to try to compensate. So Mandy's going to interlock her fingers behind her head here. She's going to pretend we super glued her elbows to the table so she can't slide, and she's just going to sit her butt back as far as she's comfortable and then rock back up. Perfect, keep going through this. And so what you're gonna notice here is most of Mandy's movement is coming right here in between her shoulder blades. It's like she's trying to get away from my fingers, like I'm tickling her back and she hates it. What we don't wanna see is a lot of this coming from the low back area. So if I did see, or if you at home are doing this and you feel like maybe a lot of your low back is moving in this, what I would say is maybe walk your elbows back a little bit and then sit back again. There we go. That's going to lock in the lower back a little bit more. Everybody's going to look different when they're performing this. Mandy here has got some really long thigh bones, so her butt's right up in the air here, and that's totally okay and normal. Everyone's going to look a little different. The mobility is going to look different. But what do you feel, Mandy? What's working right now?
Mostly I feel stretch like just below my shoulder blades and kind of in my lats too.
Perfect. That's exactly what we want you to be feeling. If there's pinchiness in the hips at all, if the back is hurting with this is not the right exercise for you, you can always reach out to us or click on one of the resources that pops up onto the video here. Take advantage of other things that are out there for you. I'm not married to this one thing, but I love this exercise. I use it specifically for myself.
Yeah, this feels great.
Stretchiness through here. Little bit of maybe stickiness happening here. That should slowly get better the more that we do. I'd probably try 20 to 30 reps of this and then flip over. Actually, we're gonna add one more thing to it. So in deadlifting, Mandy, what do you feel when you deadlift?
I feel my back most of the time.
Your low back area?
Yep.
Okay. Yep. And when you're helping people in the office, what do you want people to mainly feel?
Mainly for complex movements, I don't want them to feel any one specific spot, but if they are tending towards something, I want them to feel like big butt cheek work rather than like any specific pinpoint spot. Totally.
And a lot of times too, when people feel pain in their deadlift, they say, I can't deadlift anymore. They've been told not to. Or they just stop altogether and try rehab and then maybe introduce it later on. And I've seen people come in with a painful deadlift and we can still continue to deadlift same day just with these simple modifications here. So the reason I flipped Mandy onto her back is because we're going to do what we call a glute primer. Where'd that band go? Great. Band. If we have a band at home that's like this, perfect. It doesn't have to be this thick. You can use those small, flimsy, rubbery ones as well. It just might take a little longer to get to your fatigue point. But what we're going to do is slip our feet through here, tops of the knees. And what she's going to do is try to stretch the band with her knees as much as she can. And she's keeping that the whole time. She's not losing that as we're going up into a bridge. And back down. Perfect. This shouldn't take all day. I know that typically we only have so much time in the gym to do what we need to so we can get back to our life. So as much as you can stretch this band and as quick as we can go in those glute bridges, the quicker we fatigue and the quicker we're done.
Yeah, I'm already feeling it.
Exactly. And to point to where you're feeling this.
This is mostly like big back of the butt cheek and into the sides a little bit.
Absolutely. What would you say if maybe people are feeling some pinpoint?
If they're feeling pinpoint, either we can add a breathing component. So try and fill your breath into your waistband. So take a deep breath in, fill up that waistband. And while we're doing this, we can keep that pressure the whole time. That may take away that pinpoint tenderness. Or we can play with the angle of our feet a little bit. Walk your feet out, try the same thing, or walk your feet back. Probably walking your feet back will feel better.
Absolutely. And two, sometimes people may not feel their glutes right away in this. So what I'd say is bring your feet together. Spread the band as far as you can. You can't go any closer than here. So you can only press out wide 20 times for me. Tiny little movements here. She's going to be really forced to feel the outer part of her butt cheeks working.
Oh yeah.
Should
Feel
not
like
be
a
painful.
butterfly.
There you go. Just muscle fatigue. Go until you hate me for it.
Starting to hate you.
Just until you feel like you need that break. Take a little break.
Good. Yeah.
And then repeat again. Go, 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 go until we feel a really crazy butt cheek burn going on. Take a little break. And now go back into our glute bridges. And we may be forced to not feel anything besides our butt cheeks now.
Yeah, I'm definitely feeling butt cheeks now.
Absolutely.
That is for sure.
I love this. I've seen banded glute bridges work wonders for a lot of people with low back pain when squatting and deadlifting. May not even be pain, might just be overactivation. Sometimes people come in, they're like, I don't know how to get my hamstrings or my low back to activate in those movements, and I need some help figuring out how to get my mind connected there. This specific exercise, sometimes you're forced to not feel anything besides your butt cheeks. So when you go right into your deadlift, now there they are. Hello, butt cheeks.
Yeah, and the key with this is you have to make it hard. So if you're somebody who deadlifts 300 pounds, you're going to have to smoke your butt cheeks before you get to that deadlift, or else it's not going to translate. The more effort you feel during this warm-up and the more kind of spicy this region gets, the more it's going to stick without you thinking about it.
Totally. I think this is the number one thing I ask. We talk about habit changes in the office a lot, and too many times do I see that it's just a proper warm-up that's lacking in people's routine. And it's not that we need to take them away from deadlifting or anything of that sort. It's just building a proper warm-up in. Dynamic stretching is wonderful, but it's not creating a mind connection to the areas that need to be working when we're doing these complex lifts. So if banded glute bridges, this simple exercise is not in your routine, just build that in and see what it does for you.
Absolutely.
Cool. All right, so if you guys want some help, banded glute bridge is not feeling so good, not helping you. T-spine extension, the first one we showed, not working so well. That's not the only two things that you can do to help with back pain and deadlifting. So reach out to us. We can help you virtually or in person. We'd love to help guide you in the right direction.